Welcome to On Call with Dr. Jason Golbin. I am super excited today to bring an amazing guest to the table. Next to me is Dr. John Georgie Mathew, who is Chair of Emergency Medicine at St. Joseph's Hospital. In addition, about a year or two ago, he took on the role of Associate CMO, Chief Medical Officer, in that building. We are really excited and blessed to have him today. First, Georgie, I have to ask you the question. Now, I've known you for a ton of years now. Nobody calls you John. Everybody calls you Georgie. I've never once truly do not know the origin of Georgie. Please tell the audience.
It's actually pretty straightforward. You know, my family's heritage, and I'm first generation here. My parents came here in the 70s, but they're from South India, Kerala. It's a Christian state, or a majority Christian state there. So when they came here, you typically have a house name, and then you have your official name, your baptismal name. So it was John Mathew, but Georgie was the nickname that my parents gave me. But my brother, he's a physician too. It's Thomas Mathew. His nickname is Jomi, and that's what he's called.
Everybody
He actually
calls him
changed
Jomi,
it.
yeah.
He actually, on his photo ID, he has Jomi Mathew. Like,
What does your ID say?
Mine says John Mathew, and like I was working a shift at Good Sam on this Tuesday, and I know the security guard from like 2007. And I grabbed the wrong ID, so I had to get it replaced. He's like, I couldn't find you in the system.
I looked everywhere for Georgie.
I looked everywhere for Georgie. I was like, it's John Mathew. He's like, where did that come from? I had the same conversation with him. So it was actually fun.
It's great. And everybody knows you as Georgie. You're introduced as
Yep.
Georgie. And I think, can I say frankly, Georgie fits your personality amazing. You
It's
know?
only when I'm in trouble every now and then somebody calls me John.
That's right. So look, you're an emergency room doctor. Yep. That is a tough job. We see it on TV, and we'll talk a little about that. But I just want to share with the audience that when I was starting as a young attending at Good Samaritan Hospital, where you were a young attending,
Yes.
I would get called down as the ICU doctor to the ED to see a patient that you all have teed up for us that needs to come upstairs for our intensive care. But often we needed to do a procedure prior to them leaving the floor for their safety, whether it be intubating them, putting an airway in place to secure their airway, or putting a central line, and something that took some level of skill. And the sicker the patient, often the more skill required. So I will say, and I'm sure you remember that I would often say to you, Georgie, you want to do me a favor? You are so technically skilled. Would you mind taking care of that patient? Do you recall that? Did that bother you?
No. Like there's different fields of medicine for different people. One of the things that drew me to emergency medicine, first of all, it's the relationships that you have in there. Although it's episodic care, you have to talk to people. You have to have technical skill. And I used to they'd be like, Matthew's in here again, bumping in to do a procedure. But, I love that aspect of emergency medicine because, you can really help a patient with a specific procedure. So I never shied away, and I love doing procedures, even to this day.
I greatly appreciate
I got to share it with my residents though now and my PAs.
And it's hard, right?
Yeah,
but you have to watch and guide them, but you have to
correct.
It's so much more valuable to now impart that skill, that knowledge.
That took a little time for me. I remember. I'm going to give you a story. I remember when I started at Good Sam.
What year was that?
2007.
Okay, and we'll go back to your prior history before, but keep going.
But I was working with one of my residents, and we had a patient that required a transvenous pacemaker.
Okay.
So you have to put a cordis line, and then you have to float it. And I remember I jumped in, and I did the procedure. My resident's like, hey, I was like, I got to get this. I let him do the cordis, and then I was floating the pacemaker. And I remember I sat afterwards, and I'm, trying to be core faculty and working with the guys. And I remember I got pulled by one of my fellow docs and the program director's like, Mathew, I know you're a first year attending, but you're going to be teaching these things to these residents, and they, and I learned, and it took a little time, right? I was a chief resident also, and I knew that. I was like, yeah, you know what? You're right.
Yeah.
You're right. I can't just.
It's important to grow that next generation.
You got to be there to help them, and you got to be there in case they can't
keep them in the line.
But you got to, part of that teaching is important. So that was an early life lesson for me as an attending.
Well said. Let's go back. Why emergency medicine? Give me how'd you get into medicine? Where'd you go to school?
Good,
etc.
Great question. So my family, my mom was a nurse. My dad was actually a lab tech. But he's also a priest in the Orthodox faith. So I grew up in the Bronx. I was born in the Bronx. My dad actually worked, and I remember like childhood, right? My dad worked at, I can say hospitals, right?
Yeah.
St. Barnabas Hospital in the Bronx. My mom worked at the
famous
VA.
Barnabas where
Yep.
everybody trained.
So, I remember as a kid, I used to get dropped off from one hospital to the other as they're exchanging, right? Their first generation, they came to this country and they hustled, they worked hard. My dad, I still remember, worked 2 full-time jobs, Monday through Friday. 6 a.m. he left, came home at midnight.
Wow.
Went from Barnabas, had a little break, went to Monty, and he came home. And I, as a kid, I'm running around. I just saw the exhaustion on his face. He worked 1 shift on a Saturday, and then Sunday he has church service.
All right.
Right. So he lived a busy life, all that time. So, like at times we'd get dropped off from one to the other. And I still, I remember this to this day because I used to run around Barnabas as a kid. And I still remember one of the nurses that knew me as a little kid. And she was from the same culture as my family. And there's a term called mone, which means like child or like, endearing term for a child. And throughout, and why I went to the Bronx, I really only applied to city hospitals in New York. I'm a New Yorker. I couldn't leave. But I ended up really choosing between the 3 hospitals in the Bronx. It's just where I wanted to be. And my dad worked there since '79, so they knew me. But through my residency, she called me Mone. She didn't call me Dr. Mathew. She didn't call me Georgie. She just called me that, when she was talking to me. So it was, my dad had a lot of pride in, his son who grew up there. And I loved it there. It was where I was born, where I learned to train and,
Amazing training. We have so many
Yep.
ED docs that we know we work with that have trained at St. Barnabas in the Bronx and are incredible doctors. They're the ones I like to say that when you're sick on the table looking up after a car accident, that's who you want to see looking down at you.
Yeah. And so emergency medicine, actually, I was doing, I did trauma, I did surgery. Really, honestly, it came down to between surgery and emergency medicine for me. And, I loved trauma. I love the aspect of that, being able to, because when you think of episodic care and things like that and really taking care of a patient, you can make quick decisions that can save somebody. But to me, it ended up, I remember the quote, actually. I'm going to say his name, Dr. Vijay Akapetti. He was the associate chair of emergency medicine there. And I remember I was doing a night shift with him one day, and he says, a lot of people will talk down to the emergency department. You're a master of none, a master of all, right? And he says, but at 2:00 in the morning, when you're taking care of that patient and you're arguing with, and I respect every field of medicine.
course,
Let me
of
not
course.
get that. And you have to argue about that patient. That patient is in your hands, and you have to make decisions that are life and death. And you're going to tell that consultant or whoever else, I need you to come here to evaluate and take care of this patient. And so that was like one of the I was just like, that's true. And you run in from one room, I'm dealing with the cardiac arrest, I'm dealing with the OB emergency, I'm dealing with the opto emergency, and that kind of drew me to the world of emergency medicine.
So how'd you end up here on Long Island?
So, I did my school. So I did a 7-year program out of high school. At NYT, which is NYTCom now. It was an ICOM back then, but I did the BSDO program. So it took me to Long Island for my my undergrad and my med school, and my wife at the time. She was from Staten Island.
Oh, I'm from Staten Island.
Yeah, I know that we were going to talk about that. I hated going there.
I think
hated
it's
sitting
the
in
best
traffic.
pizza, but that's a different story. But yes,
We'll
horrible
talk
traffic.
about the best pizza because I have the place in the Bronx.
The Bronx, right? I knew you were going to say
Between the Marshalloo and Woodlawn stations on the 4 train up, the last station, Frank's Pizza right there on the right side. That's the best pizza.
And if you talk to the Connecticut guys, they think
I know.
they have the best
I've had discussions with Gary Havikin about
exactly.
his pizza in Connecticut. I don't see it. But my wife was going to Stony Brook at the time, so we made relationships here in Long Island. So honestly, when I finished residency, it was a tough choice. But I had a lot of friends, a lot of family out in Long Island. So we were thinking Rockland County and thinking Westchester County because my parents are still in Rockland County, and we made the decision. And then at the time, Barnabas and Good Sam, the residencies, we were neck and neck with each other in everything. We competed, whether it be emergency medicine, poster presentations, to research, to, our exam scores on things. So I knew Good Sam. I knew it was quality. I loved the feel of teaching. I was chief resident at St. Barnabas, and I wanted to continue. I loved the education part too. So when I decided it was going to be the island, I interviewed at a few places. Actually, I interviewed at St. Joe's with Dr. Bruni. But my mindset at the time was, no, I got to be in a big
Yeah, big
academic stuff.
academic.
I got to
felt
be
the
in
same way.
trauma.
What year was this?
This was 2007.
Okay.
So like 2006,
Yeah, right.
I
We
started,
came out at the same time, right?
started interviewing. And so, Good Sam was like the logical choice for me. I loved it. I still love working. I actually work there on Tuesday. I still work clinically at the place. It's
Special
a great
place,
place. Yeah, special place. But my growth there, and I was just talking before, I started at Good Sam in 2007. And, even while I was in residency, I did a training in healthcare policy fellowship. I was chief, and I got to see a little bit of the side of medicine where you're looking at not just the policy related stuff, but really just the administration and running of a good emergency department. So it always, it was always in the back of my mind, but listen, I had to learn the craft of
That's right.
practicing emergency medicine. You got to be a good physician first. But I got the opportunity at another health system, like not even 2 years into me being an attending, to take over as an associate chair of a department. But it was a community hospital. I was like, it's a community hospital. But when I got there and when I took on the role, and I had two roles now, I'm still learning to be a good
That's right,
emergency
that's right.
physician, but I'm also now taking on the administrative role. But it kicked my butt. I remember I talked to my wife. I was just like, wow. I'm really, because you end up understanding the
different skill set.
community emergency medicine. You end up in, and there's pros and cons to everything, but you really are MacGyvering a lot of things. You don't have the same consultants, people running down to help with the care. You're doing all those hematoma blocks and lines and everything else, and making the phone calls to try to get people. There are not consultants that come down all the time. So it really taught me something, like people joke around like, oh, if you don't work and you work in this small community hospital, you're really doing stuff. And there's Midwest ERs. I shout out to the guys there that maybe sometimes the only physician in the hospital,
coverage, yes.
right? You end up learning your craft. So I really learned that, wow, this is emergency medicine. There's so much more than only just being a trauma center. But, I love all aspects of it. I still love going to Good
Yeah, your
Sam. I
passion
work at
shines
St.
through,
Joe's, it's a great place to work within Catholic Health, and that variety. I work also at St. Francis. It's been a while since I've been at Mercy's ED, but I still work in all of those sites because you learn different things. And, as I stepped into leadership when I came back, and, with even progressive, which, my leadership style is also by
Progressive is your ED group. That's
Correct,
that's really
yes.
our
So-
Catholic Health partner
Correct.
in running 4 out of 6 of our hospitals.
Correct. And for me, being boots on the ground helps me lead. If I can ask somebody to do something and I'm not doing it myself, it first of all, it just speaks to not understanding what's going on in that department. And there's different styles of leading everywhere. And sometimes you can't do that. But for me, it allows me to be able to say, I need this done. This is how we're going to do things, because I'm doing it with you.
A couple of insightful things. First of all, I think the leadership never ends. Even in my role, just today, I was in one of our campuses tracing in preparation for his visit from our friends at the Joint Commission.
Gotcha.
And the nurse said, wow, we were touring the OR. She said, you're so inquisitive. I said, look, I may have been doing this for, I don't know, a decade plus as an administrator now. I still learn every day. I'm learning from you, and thank you for sharing that knowledge. And I hear that shining through with you as well. I think that's important, that people, as the leader, just because you're the leader, you don't assume that you know everything.
Yeah. It actually, that next step also, I was going to talk about, and I have something I'm going to surprise you with.
Okay.
But, so, my role in then getting into administration, and one thing, I was always about is, you got to take care of the critical patients. You be a great physician.
Great physician first, I agree.
Great physician first, but then sometimes, I stepped into the urgent care world a little bit in the transition of starting or helping to start progressive emergency physicians. And I learned one thing about patient experience there.
Oh, my
that,
favorite.
honestly, I was about, I got to get to my critical patient, but, there's a patient that looks okay. He's not, but I learned how industry looks at things, and no matter what, and, I know physicians get upset when they talk about, well, we're doctors and we need to take care of who's sick if you're not sick, but patients and people, our community, they have choices. They can choose where they want to go.
Absolutely.
And I learned it firsthand when I got into the
Urgent care. That's a good point.
I really learned, oh wow, how everything else that's not care related is time that is wasted. Not saying it's not important, right? We need to register, we need to do this, but what that patient cares about is getting to the nurse, getting to the doctor, getting to the PA. And, when they cut out, well, no, get the patient back. This is how you take care of things. It really clicked for me, and I was like, there's so much more to this, and just understanding that we really need to take care of our patients in every aspect of things. And then like in my new role, right, as an associate CMO, I was just like, I'm learning. You've sent me some stuff, and I just picked up, a book a couple of months ago, The Essentials, the Guide to Being a CMO, and I'm reading through the book, and I get to Dr. Golbin's chapter in the book. You didn't tell me. Yeah. You didn't even give that as some reading
material.
But no, it's a great chapter.
Oh, thank you.
It's something that we talk about often. And you're one of those guys that lead that role in patient experience, and really it outlines the growth that Catholic Health, all of us, right? What we've done as a system, what we've done as individual clinicians, nurses, things like that. And it's a great chapter in the book. So I was going to surprise you with that, because I honestly, I had no idea your face was going to be in the book. Yeah. And then I get to the chapter and I'm like, oh, I'm surprised. It was good. It's a good book.
Thank you. I appreciate that. I wrote when I was a fellow at Mayo, I wrote a chapter on pulmonary embolism in the cardiology board review textbook.
Yeah.
It's still in there now, 10 years later. So I get a call once a year from the cardiologist. Some cardiologist says, I'm reading, is this you? I said, yeah. Well, they should have updated the chapter all these years later, but yes. But I thanks for talking about patient experience. I don't know if you heard yourself, but when we started this conversation, you talked about being a great ED doctor is not just about, curing the critical patient, doing the procedure, but you talked about that connection in the emergency room. Now, I that's really important. Now, there's a TV show that a lot of people are watching called The Pitt.
Yeah.
And this is Noah Wiley. I have to say, I'm going to say I'm a fan.
I'm a fan of the act because it brings back that feel of that ER show.
And he's the executive producer. Now, there's some stuff pushes it. In the first episode, it's turned a lot of people off. He's running a code. Somebody's trying to die, and he's trying to save them. And the administrator comes down and pulls him out of the code and says, we have to talk about your press gain and your patient experience. Goes completely unrealistic. But as you watch through the episodes, if you listen to what he's talking about, he talks about making that connection with the patient. He talks about the importance of empathy, which, of course, we teach with our principles of ESP as part of our patient experience program. And I know from knowing you and seeing the way you practice that you do that. The experience of our patients, that connection is critical. And expand upon that a little. Why is that important to you?
Yeah, so, and first of all, with the shows, there are things that are very realistic about the show, and then there's things that are not that you'll see. But one thing, and why
did you see the retrograde intubation?
I didn't yet. I'm only on like episode 3.
I've never done one of those. You may have, because you're my procedure guru.
Yeah, but, I've had to go back. Typically on a line there. But yes,
that's what they do. They did it on a line. Yeah, it was
back. Bring it back.
That's exactly what they did.
Yep. So. It's happened, and but the thing about the show, right, and why people are drawn to like that, the show, right? Your doors never close to an emergency department. Yes. The next patient that comes in could be something. So you're dealing with people, and this is I was talking about this with some of my residents. No matter what, like I can be in a room, and I've been seasoned now. I'm practicing emergency medicine 20 years, and I may know pretty quickly within 5 people in front of me who's sick, who's not sick. I don't know why you're here, right. but you don't understand. Like, so let's say somebody comes in at 2:00 in the morning and they have a stub toe or maybe a small fracture. Like, what are you doing here? I don't know what's going on. Maybe they got a marathon that's going on in 2 days. You're seeing them in probably one of the worst days of their life, no matter what. Even if they're okay, they don't know that they're okay. And so that takes us, like a special group of people to understand that. Now you can be, you may just love the procedures and things like that. And I know, people have different personalities and I'm not talking about every subspecialty, there is a person for that here. When I see, and even, when I interview my docs that are coming on, we've started a residency program. We're in our second year of our residency, which I'm very proud of. Yes. But you look for certain examples of people that can have resilience, that can be able to make the connection with the patient, because it's more than just brains and understanding and moving through things.
Now, as an emergency room doctor, right, we see, like you said, we see all of the classic diseases and diagnoses, but every so often there's one or two cases that just stop you in your trail. And there is a famous patient that you've taken care of. Not the patient is famous, but the story and how you took care of the patient. There's a young baby that I actually didn't hear the story firsthand. If you remember, I called you. You probably don't remember, but I saw it on the news. And I said, George, is that you?
We're in the midst of our emergency medicine. I get called out to, hey, there's something going on outside. Car pulls up, and a young lady who was premature. And when we talk about premature, just over 20 weeks.
Just under 20 weeks, we feel that it's...
Correct. But, like even there, like there's a lot to this, right? Okay. They say 24 weeks is viability. We do some weight grams, things like that. Nobody cares about that, right? At the moment,
when
right?
It's your baby. That's right.
It's you take care of the patient. So
there you go.
Baby delivered in the car.
In the car before you got there, before they pulled up.
Well, just probably at the same time, right? Okay. So I'm, baby could fit into my hand, and I turned to the mom, because I've actually had to deliver quite a few babies in the emergency department different times in my career. And I turned to mom and I said, we're going to do everything we can.
In the parking lot.
In the parking lot, right? So, and my counterpart, Dr. Daniel was there, and, we turned to each other. I said, you take care of mom, I'm going to take care of baby. And then we had a team, and then we resuscitated, and we don't have, St. Joe's, we don't have peds. We don't have a NICU, a PICU, anything there. So we knew what we had to do, and, we called, and there's a teamwork. And I know, we see the news reports and things like that, this is what we do, and that's a child, which is always, when, I have 3 kids of my own, right? So anytime I've had to deal with something difficult with kids, it's always the most difficult that you deal with, right? You carry that, the nurses carry that, everyone carries that. So we brought that child in, and we resuscitated that child for 90 minutes there in the department.
Let's talk about that resuscitation for a second. So you're talking about a baby that's a few pounds.
Correct.
In your palm, and now...
Not even a few pounds.
Yeah, not even a few pounds. And so now, in my pulmonary brain, when I'm bagging or breathing for even an adult, you could give a significant amount of breath where our lungs can handle it. You have to be so careful just to give, tiny squeezes, and your adrenaline is pumping, and how do you control?
So it's important. So we had the conversations there, right? We've run neonatal codes because we have to be.
You've practiced them,
right? We've practiced them. We've talked about this here. We even have safety things, right? So even in the bag valve mask that we have, there's a PEEP valve that pulls over, so you can put the maximum pressure, because a child that small, you can't push air, and it's going to damage the lung. The type of oxygen that you're giving, you can't give 100% oxygen to that child.
Which are all natural things we do. We turn up the oxygen, we start pumping.
Correct. You're thinking that, but you have to dedicate yourself to understand that you have a PEEP valve, so that no matter how hard I push on this, I'm going to control the amount of pressure that's actually going into the child. And kudos to everyone that cared for that little baby. Including the tertiary care center that came to help us and took care of that baby. But in the midst of this, and how the story goes is, that happened, and I was following up for a little bit, and then we get into the second week of March, and
COVID hits. Boom,
everything changes. I went from like where I worked. I was 7 days a week. I think 7 to 11. I was there in the hospital just because we needed to. Like this was something life-changing. We may never see it in medicine again.
Hopefully not.
Hopefully not. And I just remember then in July, and we were just getting over the first hump of this, and we were just taking off our masks for the first time, seeing a face for the first time. And I got a call from somebody saying, the family wants to see you. And I was like, oh, we just gone through this. I was like, oh my gosh,
You forgot, all right, because you were busy.
Like we were running around taking care of in life and death situations. It was great. I remember my first reunion with the family and seeing this beautiful little girl. At that time, it was like 6 months, and I was just like, wow. Right? Wow. And I've stayed in touch with the family since then, and they send me Christmas cards, and I get to talk to them. I remember I was there for her first birthday. Just celebrated the 5th, and I think they showed a clip. It's on. It was so funny because I walk in there with the gift, and she runs for the gift, and I got clued in that she's a big Paw Patrol fan.
She went together, right?
She ripped through that present and she pulled it out. But when you see that, and and when you talk about preemies, and there's a lot of families out there that have to deal with a lot of different complications with preemies. it's a heartwarming story because in terms of what we do what we do.
That's right.
But there's a little girl that has perseverance and can fight through things. And that's the story really about medicine. You know, like we do our part, God does his part, and really the patient there who is fighting through a lot of it. So that's, you know, it's something that will always stay with me, you know, at the time, because everything that we dealt with around that time, and just to see that, you know, we have a lot of things that happen in emergency departments. Last words with the patient, first words with the patient. I've had numerous conversations, joyous conversations. I've prayed with families. I've talked to families, have to give families bad news. But in the midst of all of that, just to have a story like that, it's what drives everyone. And it's not just me, right? You know, the whole nursing team, everyone that was there. This is you know, something that gets you to continue doing what you do, right? So it was a great story. So just...
I love that story, but you're right. It's that's just one example of I think how you and all really ED staff touches patients' lives and their families' lives in ways that we can't even calculate. I remember St. Joseph's now does cardiac cath. Actually, it's become mega busy as a STEMI. You know, somebody's having a heart attack. The ambulance bring them into St. Joseph's, and you pop a wire in, or the interventional cardiac. But you all and the emergency room stabilize that patient. Being an ED doctor is hard. You know, how do you keep up how do you stay resilient in the way you do things? How do you stay energetic and passionate every day? Especially after COVID.
Yeah.
What are you doing around well-being?
It's, you know, for myself, right? Personal well-being. There's certain things I do. I'm pretty active, but you know, I'm passionate about sports, whether it be watching sports or playing sports. I played basketball like all my life. So, you know, I coach basketball for my, you know, like my son's team. But I also play basketball. I've picked up golf.
This is,
you know, and it's,
my feeling
it's addictive. And I was just, you know, a pre-interview, I was just talking about, you know, like the one thing about golf is, you know, like you'll have that one shot that was better than a pro. That's right. And then all 180 shots after that are in this, but it keeps you going. You're like, I could do that again. Beat Tiger. I got this drive.
I just took my first lesson of the season this week.
See, but that's what, you know, it's also, it's like that love and hate relationship with golf, but I love it out there. I like to work out a little bit just to, you know, you need something. And, you know, honestly, it's actually one of the questions I ask when I'm interviewing. We just got through our interview season. I am big shout out to our residency at St. Joe's. I'm very excited about the new class of residents. But one of my questions is, hey guys, you've had a tough day in the emergency department. You just dealt with this. What do you go home to do? And I'm looking just to see, you know, how natural. Sometimes they'll just say, well, I will, or how natural their answers are, you know, because it does take resilience to work in a place like this. And it's not for everyone, right? You need to be able to deal with high stress, make critical decisions very quickly.
Now, you look at the incoming class of residents or the medical students or anybody out there who says, you know, wow, this sounds amazing. What piece of advice would you give them, or would you give your younger self, you know, when you were just starting out and looking at this incredible career that you've had?
You know, one thing that I still remember when we looked at growing up in the 80s, right? And there was how we looked at physicians, and sometimes it's different right now how people look at physicians, but I like to go back to old school, even earlier than that, right? The relationships that you have with your patient. Like if you take everything else apart, right? If you take away insurance or administration, and we're both on the admin side, but there's a relationship that's built that nothing, like when you do your work well, there's nothing bigger than being able to help somebody, save somebody on that clinical side. There's different ways to make money. And it's not all that, you know, when you talk about there, but what I tell them, you know, like you really have to have a passion to take care of people and help people. And there's different ways to do it. I'm not saying medicine is the only way, but
there's probably a lot of easier ways.
There's a lot easier ways.
I've learned.
A lot easier ways to do that and even take care of people. But you know, that's a special connection when you make that connection with the patient. You've helped them, you've saved them, and that trust, right? And sometimes you don't win that trust, and that's why it's important. So when I talk to medical students that are there, when I'm looking at candidates for residency, I want to see somebody that has the passion to take care of people, because you don't belong in this field if you really don't have the passion to take care of people, because there's so many other ways to have a career and make money. But that's what keeps you going, right? If you lose that passion for caring for people, it's tough. You don't wake up wanting to do what you want to do unless you care for people. So I always tell people, hey, listen, you have to really understand, is this something that you want to do? Because you're going to have long hours, there's going to be loans, there's going to be a lot of different things. But if you care and you have that passion, it takes that one case that you're like, man, I really
Made a difference.
I really made a difference. You know?
Well, listen, it's been an absolute pleasure getting to have this conversation. Your passion shines through, and really in everything, not just in the medicine, but in everything you do. And we are blessed and lucky and honored to have you as part of Catholic Health.
Hey.
So thank you so much.
It's a pleasure working with you, Jason, and working for you. So,
Thank you so much. Talk soon.
all right.